The numbers show Black and Latino Americans are receiving the COVID vaccine at a much lower rate than whites. But when you add race to any conversation, it instantly becomes a tough conversation. So recently I sat down with Dr. Hildreth to have that conversation about vaccine equity. And I started by asking him about the inequities in the minority communities.
If we want to save as many lives as possible, you give it to the people that are most likely to die from COVID-19. You give it to them first. The problem is that the folks with the most risk look like me. They are brown and black. And anytime race gets injected into any of our conversations, as you know, it becomes problematic.
Here's a closer look at the numbers. The state of Tennessee is 77% white, only 16% black. Of all the vaccines distributed so far, 67.4% of whites have received the shot and only 5.9% of blacks. So that begs the question, are the vaccines getting into those communities?
They're not, and there are a lot of reasons for that. One is a lot of people living in minority communities don't have access to the places where the vaccines are given.
People say there's a fire in the minority communities when it comes to this COVID-19. And normally when there's a fire, first responders bring the water to the fire. Yes. Now we're asking people to bring the fire to the water.
That's exactly what I'm saying, that we've got to flip this around and take the vaccine to those who need it the most. For some others, there's a technical challenge because the platform of getting an appointment is all based on internet and access to internet. There are a lot of people that don't have access to that.
Dr. Hildreth also knows there is a lack of trust within the minority community about that vaccine. That's an issue he feels has an easy fix.
And that means getting trusted organizations involved. And quite frankly, Meharry is one of those trusted organizations, as are churches and community organizations.
Dr. Hildreth knows his views may not be popular, but he says he will continue to fight for what he believes in and for those who are at risk of dying and desperately need this vaccine. It's part of who he is and part of the Hippocratic oath he made as a doctor.
The most important thing is that you not do harm. And as far as I'm concerned, to not do what we know we can do because of these things that we have to deal with, in fact, harm is being done. Lives are being lost that don't need to be. And that keeps you up at night.
Keeps him up at night. Dr. Hildreth is a scientist to the core and believes the vaccine works. That's why he is so passionate about getting it to the people that need it. And it's not just minorities, but anyone at high risk, like the elderly, those living in assisted living, and those with pre-existing conditions.
Dr. Hildreth getting emotional tonight. It's so important to him. Wow. Well,